So good afternoon, and thank you for being here. And we are happy that we all together. And thanks for the moderation and the panelists. I skipped the first talk, but it's already covered by many speakers. So I'm going this is a simple talk. I'm going just to highlight the Deus 3, what's changed from 2 to 3, nothing more than this. So I have no financial disclosures, but these are my disclosures. So let's go directly. So the Deus 3 algorithm, it changes. The most important, it provides an evidence-based review of the current strategy to manage dry eyes. If we compare between 2 and 3, it's completely different, and the gap is many years, and I'm going to highlight this. It's the first line management focuses on methods to replenish, conserve, and stimulate the tear film. This was not in the DS2, with an emphasis on the ocular supplements. I'm going to highlight this, will remain the cornerstone in dry eye treatment. Also in DS3, which is just published in June 2025, it was just published, said that the meibomian gland dysfunction, a primary contributor to the dry eye disease, and it's typically treated with warm compresses, and they highlight all the mechanisms of new treatments. So, dry eye disease is caused by certain etiological drives can benefit from anti-inflammatory, and this was also highlighted in the this algorithm. And also emerging therapies such as neuromodulation via the nasal neurostimulations, it was very highlighted in this. And also they said, as was mentioned in the first session, that the lifestyle modification includes optimization, blinking, and dietary supplementation and the environmental adjustments play a crucial role. This is totally evidence-based now. So, the TEFUS Days 3 prescribing algorithm provides an evidence-based framework to offer guidelines to clinicians in selecting relevant interventions based on disease etiology that aim to provide target management of the relevant dry eye disease subtypes that an individual is experiencing. This is the new algorithm for DF3. So if you compare between 2 and 3, what happened? In 2, dry eyes was a multifactorial disease, and 3, dry eyes a multifactorial disease of ocular surface characterized by loss of the homeostasis. No, it's ocular surface and tear film that it was highlighted in the morning also result in symptoms of discomfort, visual disturbance, and often visual impairment accompanied by ocular surface homeostasis and dysregulation and inflammation with the neurosensory changes that it was highlighted. So, this is what was highlighted in the DO3, the management and the therapy. According to from the start of the differential diagnosis, moving to the diagnosis till the management. And also in DO3 algorithm, they highlighted most of these points, the iatrogenic, where it comes, the epidemiology, the pain and sensation, the photophysiology. Also, it was highlighted the sex and gender hormones. It was highlighted in the morning also, and the clinical trials and the tear film. And they classified into 4: the non-modifiable, consistent, the probable, and the modifiable. And according to each part, they are categorizing the dry eye in an evidence base to manage the dry eye disease. So, Deus 3 highlighted this: lifestyle advice, tear insufficiency, treatment of eyelid abnormalities, anti-inflammatory pharmacological therapy, oral antimicrobial agents, ocular surface promoters and regenerators, treatment of anatomical surface abnormalities, nutritional modification, and alternative therapies. All of this was described the new classification of DF3, which is the algorithm. And I will pause this. And in the new also DF3 algorithm, we can say no stone unturned. Why? Because the report divides up the available therapies in 10 sections and often organized around specific treatments for the tear stabilization and eyelid hygiene. And the DO3 discusses that the recent therapy from Alcon, and this is the new TREPT3 approved just few weeks ago. It was just after the DOs 3 weeks ago. And that this is new section on the neuromodulation that discusses pharmacological driven drugs. And this is one of the most important topical treatment nowadays for dry eye. There is other new product described also by the DOS3. I will pass this. And this is also one of the most highlighted by the DO3. Treatment of the eyelid includes the sections that the Demodex was one of the main factors in dry eye disease. And you can see how it was before and after by using either by the lutaniparal ophthalmic solution or the okra. The okra is something we eat it, Oslo. We eat the okra in our region. And it is based for many therapies that can treat the Demodex and improve the dry eye. Also, there is a section in the DO3 for the ocular surface related to the autologous serum treatment for dry eye. And because of the time, between DO3, 2 and 3, there was something called the dream state. Dream states, it was started in 2018. And at this point, during this period, publication between 2 and 3, they somehow controversial between the dream study, took popular in the dry eye therapy, and then came the DO3 that changed the dream state that most of the people was going through, and came the DO3, which is considering treatment options that is totally different than the DOS2, with especially the omega-3 and all the factors in the supplements, 1 minute, that improve the ocular surface disease. So more to come. Multiple treatments used together are the likely and the most appropriate management strategies considering the dry eye, and that DO3 really increases the evidence base for the treatment of the dry eye. I push everyone to read it. And my take-home message is, no, not this one. The management of dry eye disease requires personalized, multifaceted approach that considers the underlying cause and patient-specific factors, while tear supplement remains a cornerstone in the therapy. Growing evidence supports the importance of optimization of the meibomian gland function and implementing lifestyle modification, which should be changes in dry eye, and the DO3 approaches of the identification of the etiological drivers from individual patient to patient according to his problem. So before I leave, this is our second, I have 2 children, the Miyom and the Egyptian Society. So this is our coming meeting next week in Egypt, during the opening of our large Egyptian museum, which is coming in the November 1st. And we have a huge number of speakers from the Middle East and globally, and coming also a training school from UK to Egypt. So we hoping that I can see you all in Egypt next week. Thank you so much.
Thank you, Dr. Ashraf, for the presentation and for all the things that you have done for the myome during the past years.